A soft bulge on the belly that appears when you stand or cough is often a ventral hernia. A ventral hernia is a physical gap in the abdominal wall. In adults, that gap does not close on its own. There are two main types: primary hernias in untouched abdomen and incisional hernias forming along old surgery scars. Surgeons commonly recommend repair when the hernia enlarges, causes pain, or risks trapping a loop of bowel. In the operation, the bulging tissue is returned into the abdomen and the muscle defect is closed with strong stitches. A flexible surgical mesh is placed over the repair. It integrates with your tissue and lowers the chance of recurrence. Surgeons use three main approaches: open with one incision, laparoscopic keyhole with small cuts, or robotic-assisted. Most repairs are done under general anesthesia. Many smaller cases go home the same day or after one night. For the first 2 weeks, walking is encouraged. Heavy lifting, straining, and vigorous exercise are avoided. Desk work often resumes in 1 to 2 weeks. Heavy physical work usually waits 6 to 8 weeks or more. Risks include fluid collections, infection, and recurrence. Recurrence is lower with mesh and planned elective surgery. Stopping smoking, controlling blood sugar, and reaching a healthier weight before surgery improve healing and lower recurrence. After healing, most people return to a comfortable, active life with the bulge gone and pressure relieved. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.